Hello, thank you for joining us today. We are presenting one of the MTAC, the Medi-Cal Mobile Crisis Training and Technical Assistance Center's supplemental trainings on psychiatric advanced directives, commonly known as PADS. My name is Danielle Ragib, and I'm a training and technical assistance specialist with the MTAC Center. And I will be presenting today with my colleague David Lopez.
Hi, everyone.
Just a quick disclaimer. This presentation was prepared for the Medi-Cal Mobile Crisis Training and Technical Assistance Center, like I said, and the MTAC project, which is funded by the California Department of Healthcare Services and administered by the Center for Applied Research Solutions, commonly known as CARS. All the material in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from DHCS or the authors. Citation of the source is appreciated. Do not reproduce or distribute this presentation for a fee without specific written authorization from the MTech project. This presentation is being recorded and will be posted on our website. Uh, David Lopez and myself have certified that we have no relevant relationships with any commercial or nonprofit organizations that represent a potential conflict of interest. And this, like I said earlier, this training is brought to you by the MTAC project and mobile crisis services through the new benefit. As we know, mobile crisis services are meant to provide rapid response, individual assessment, and community based stabilization to Medi-Cal members who are experiencing a behavioral health crisis. Um, the purpose is to really provide relief to someone who's experiencing a crisis in the community, as well as support de-escalation and stabilization, and just reduce any risk of danger or subsequent harm, and avoid unnecessary emergency department care, psychiatric inpatient hospitalizations, and law enforcement involvement. Through the Medi-Cal Mobile Crisis Service benefit, we have this new direction for mobile crisis services here in California. First, as we've called it, a transformation of care here. And so really like I previously said, where mobile crisis services are really more focused on resolving a crisis in the community and providing relief to someone when they're in crisis. And while doing so, making sure that we're using the least restrictive means necessary. Mobile crisis services should be person centered, trauma informed, equity driven, provide brief intervention, so de escalation and resolution focused, working from a lens of least restrictive interventions, as well as being culturally responsive, linguistically appropriate, and accessible. Again, just a quick recap. I'm Danielle Ragib. I'm a technical assistance specialist at the Center for Applied Research Solutions on the MTech project, and I'll hand it over to David.
And I'm David Lopez, and I'm also a technical assistance specialist with the Center for Applied Research Solutions. And now I'm going to go over our agenda. So what we're going to go over is the Behavioral Health Information Notice 23-025 on psychiatric advanced directives, also known as PADS. We're going to provide an overview of PADS and their relevance for mobile crisis teams, what to do when we are encountering PADS in the field, and PAD development resources as part of follow-up. And our learning objectives for today are as noted. What we hope that you learn is to learn the use and the purpose of psychiatric advanced directives, understand ways of identifying a PAD in the field, understand what may be included in a PAD and the appropriate action to take, and review which ways to connect members to PAD development services as part of post-crisis follow-up.
Thank you, David. All right, just a quick overview of what the Behavioral Health Information Notice 23-025 says on psychiatric advanced directives. So, a psychiatric advance directive is a legal document in which individuals living with mental illness have the opportunity to state their wishes for treatment or designate an individual who is empowered to make treatment decisions on their behalf if the individual enters a crisis and is unable to make decisions. Usually, PADs are developed when the person is not in a crisis, so they're in a state of thinking where they can think clearly, reasonably, and logically. For mobile crisis teams, a psychiatric advance directive may be appropriate as part of the crisis planning process in some circumstances or as part of the follow up. And so this means, and we'll go over this more in detail, but maybe this is something that you provide support or resources to someone who doesn't have one, who may benefit from one in the future. You can also see the National Alliance on Mental Illness, psychiatric advance directives for any additional information. And everything in this PowerPoint is linked, and so you will have direct access to the resources. Quick overview of PADS and their relevance to mobile crisis teams. So, how you might see them in the field and what you should do. Again, a psychiatric or mental health advance directive, commonly known as a PAD, is a legal tool that allows a person with mental health challenges to state their preferences for treatment in advance of a crisis. And we have a resource here, a practical guide to psychiatric advance directives from 2019 that you can click on to further explore. The purpose of a PAD is to allow the person to give instructions for future mental health treatment or appoint an agent to make future decisions about their mental health. So when we say agent, we mean another individual or a doctor or someone who can, it could be a family member who can make decisions when they're in a mental health crisis and they don't have the capacity or the ability to make those decisions for themselves. The document again is used when the person who created the document experiences acute episodes of psychiatric illness and becomes unable to make or communicate decisions about their treatment. Just a little bit of information of PADS here in California, which I think is very important for us all to know. In California, psychiatric advance directives actually evolved from advanced healthcare directives, so you may be more familiar with that. And I believe the abbreviation for those are AHCDs, but we're just going to call them advanced healthcare directives. Advanced healthcare directives can be used for planning for future circumstances that the person has not experienced and are more commonly used for end of life events. So, um, usually, if someone is sick, they have a terminal illness, they might develop an advanced healthcare directive or even before that, we may have one when we're healthy and we just designate, our plans for when end of life events happen or who might make decisions on our behalf. And those are things that we don't necessarily know that are going to happen. It's just kind of planning for future circumstances that we haven't yet experienced. PADs outline future preferences based off past experiences. So they enable an individual to facilitate their own care when they cannot express their wishes and preferences. PADs can support in de escalating crises and helping the person return to baseline. So, someone who has a PAD may have experienced a crisis, a mental health crisis before, and they may know exactly what they don't want to happen and what they do want to happen in terms of their care when they're in a crisis. PADs tend to focus on the voice and choice of the person and their decisions made at a time when they were able to plan logically for their care. So PADs outline what they want their care to look like when in crisis or unable to make a decision on their own. Approximately 27 states have enacted laws and policies recognizing PADs since the 1990s, including California. While all states have an advanced directive law, many states, including California, do not have a specific PAD law, but we do have some policies recognizing PADs. So, what is covered in a PAD? And these are some common things. They're not completely. This is not the full list, but these are some common things you might see in a psychiatric advance directive. So, identifying information, emergency contact information. You might see their healthcare team identified, including their contact information. So, their therapist, psychiatrist, maybe they have a case manager, or even a primary care physician. You might see information about their medication, who is their appointed decision maker, and their desires for care. So, what supports them in de escalating might be on there, um, what medical facilities they prefer or they're familiar with, restraints versus seclusions, medication via injection, pill or liquid. So, like, whatever their preferences are, if they have allergies, things like that. And then also statements of preferences of who to notify, who to exclude, and caretakers for dependents. So if they have children or other dependents, who is responsible for taking care of them when they're not able to. All right, potential uses of pads. So, like I said, usually pads are for future situations that someone may have experienced before to help guide where they might not be able to guide their mental and physical treatment. So, in those moments where they can't make decisions for their care, allowing individuals to express their preferences and share them with others, upholding a person's independence, their respect, and capacity to self manage their care, providing a mechanism to educate the community, establish confidence in treatment systems, and support individuals to navigate healthcare systems effectively. A little bit more background on PADS in California. Um, California's advanced directive law, which is California Probate Code 4670-4743 from 2022, includes recent amendments to the California Probate Code Law 4615, which recognizes healthcare decisions, including mental health care decisions, and revises the statutory Advanced Healthcare Directive form to clarify that a person may include instructions related to their mental health conditions. California recognizes advanced healthcare directives, including PADs, developed in other states, and they can be registered here in California. So, advanced healthcare directives can be registered here with the state, and they can include a PAD. So, you may not necessarily see a PAD separately. You may see it embedded in what's called an advanced healthcare directive. There is no current registry for a PAD here in California. However, an individual can register their PAD through their advanced healthcare directives with the state and embed their PAD into their directive. And so that's more commonly how you might see it here in California. You still may see a psychiatric advanced directive separately, individual from an advanced healthcare directive. It may not necessarily be in the registry, or it might. There's no like standard there in terms of like requirements for the registry and things like that, but the registry does exist for the advanced healthcare directives, which can embed the PAD. And the registry is the Advanced Healthcare Registry, and it is overseen by the Secretary of State here in California. And we're going to go over a few ways to access this. And they also here on the link you can see there is a frequently asked questions list, and it's very helpful. And just to reiterate why PADs work and how they can empower someone and really honor their voice and choice, we took a few quotes from the SAMHSA's Practical Guide to Psychiatric Advanced Directives, and I'm just going to read them. The reason I worked so hard to get my own personal PAD in place was because I never knew when the day may come that will not be mentally stable enough to make decisions regarding my own psychiatric health care. Trusting my brother and sister in law wholeheartedly, I know that with them on the pad to make those decisions for me, I'll be taken care of. They know my wishes and are aware of the medications and procedures I am or not willing to take or be part of, and I know they will advocate to the fullest for my wishes and care. That was by Charlene Lee. And then during the darkest moments of the pad speaks for me by allowing me to be an active part of my treatment when I am not able to. And that was from Erin Willis. Again, a little bit more on why PADs work. Person centered care. It supports autonomy, self determination, and empowerment, voice and choice. We talked a little bit about this. Making a plan and creating a PAD is a way for an individual to be in control of this part of their behavioral health and the decisions and the outcomes that happen. PADs increase treatment adherence after discharge, including medication adherence. So there's a benefit to having a PAD for someone who, may have more acute crisis episodes. People can make better decisions about how they want to be treated in a behavioral health crisis when they are not in a crisis. So when they're not in a crisis and they're able to think about what they want to see in terms of their treatment and care, it makes them feel better, right? It makes them feel like they've made choices for their own treatment, and it's empowering. Members can say what treatment works and what treatment does not work. Individuals can involve their social support networks and family members in planning and future care conversations. Conversations around crisis can be difficult. However, when executed in an appropriate manner, these types of conversations have the ability to empower a person and support network of their choosing to support a continued path to safe recovery. Uses of PADs may shorten the duration of crisis by telling healthcare providers what interventions work and which ones don't. This can potentially help avoid hospitalization, reduce hospitalization duration, and or speed up recovery. Those with PADs were much less likely to require coercive intervention during mental health crises. And again, this is all coming from the SAMHSA Practical Guide to Psychiatric Advanced Directives.
All right. So now we're going to go in and go over to encountering PADs in the field and what that may look like for us. Accessing a PAD during a mobile crisis response. It's important to note that the likelihood of a mental health crisis team accessing a PAD from the registry directly is very unlikely due to the nature of the request process. However, it would be a best practice for counties to request from registry when it's known that the individual who has received receive the crisis service has a PAD. The standard process for accessing the California State Registry for Advanced Healthcare Directives. The Secretary of State maintains the Advanced Healthcare Directive Registry as required by Probate Code, Section 4800, which allows a person who has executed an Advanced Healthcare Directive to register information regarding the directive with the Secretary of State. This information is made available upon request to the registrant's healthcare provider, public guardian, or legal representative. A request for information must state the need for the information. The legislation requires the Secretary of State to receive and release a person's advanced healthcare directive, transmit the information to the registry of another jurisdiction upon request, respond to a request for information received from the emergency department of a general acute care hospital, and establish the fee for filing the advanced healthcare directive or information relating to such directive. Who is authorized to obtain information regarding my advanced healthcare directive? Only you, your healthcare providers, your public or court-appointed guardian or conservator, and any agent designated in your current advanced healthcare directive can have access to your registry information. They must provide verification of their identity and their right to have the information about your advanced healthcare directive. All requests for information must be in writing. All requests to access the registry must be made in writing and/or letterhead, either county or hospital. Requests can be made directly to sfmail@sos.ca.gov. Subject line can include Advanced Healthcare Registry Request, Urgent. The inbox is monitored daily from 8 a.m. to 5 p.m., Monday through Friday, so anything after hours would be responded to the next day. Average response time is 2 to 5 business days, but could be faster, often before close of business on the same day. The link to that registry is below. And now we're going to go over accessing a PAD during a mobile crisis response. And here's a little bit more information about the California Advanced Healthcare Directive Registry and their contact information. So their office hours are Monday through Friday, 8 a.m. to 5 p.m., and they are excluding state holidays. Their office location is 1500 11th Street, second floor, Sacramento, California, 95814. And then there's some driving directions that you could access there on the actual PowerPoint. Their mailing address is Advanced Healthcare Directive Registry at P.O. Box 942870, Sacramento, California, 94277-2870. And the phone number is 916-653-3984. And again, there's a link for that registry below, contact. And again, accessing a PAD during a mobile crisis response. Without a PAD registry, it can be a challenge to directly access the PAD for the member in crisis. If possible, ask the individual or collaterals present if a person in crisis has one of those, a PAD in place. A PAD can have alternative names such as a care plan or a mental health advanced directive. If the person in crisis or any collaterals present are unable to confirm whether or not they have a PAD, mobile crisis teams can ask to check for the following: potentially a wallet card. There's also a SMI Advisor mobile app and My Mental Health Crisis Plan app. It's important to seek clarity and ask questions from admin around where advanced health care directive information will be stored and what would be made accessible for Medi-Cal members. PAD development resources are part of follow-up. So taking action when PADs are present. The PAD should be followed to the fullest extent possible. If an instance, PAD should be used when a person becomes unable to make decisions during a mental health crisis. However, the hospital, facility, or healthcare provider can object to some parts of the directive at the time a member is admitted for treatment. A PAD would not be followed for the instances below. If it conflicts with the generally accepted community practice standards, if the treatments requested are not feasible or available, if it conflicts with emergency treatment, if it conflicts with applicable law. The PAD should include release of information, authorizations for all family members, treatment providers, hospitals that may need access to the PAD in times of crisis.
Thank you, David. And just a few referrals and resources for PADS that we wanted to offer for you as mobile crisis teams throughout the community. And may, like David was mentioning, you may not have immediate access to a PAD to a person you respond to who's in crisis. You may not get it till afterwards. You may have it for next time if there is a next time. They may have something written, they may have a printed paper. You may go through the registry at some point, but these are additional resources just to learn more about PADS and also to provide follow-up care after a crisis. So if someone is wanting to pursue a PAD after they experience a crisis for the future, these are resources that you can provide on how to guide them and where they can go to do that. So, mobile crisis teams can provide education and resources for the development of PADs to individuals and families in crisis when it seems appropriate. This can be done during the crisis planning state and or during the follow-up check-in in the post-mobile crisis encounter. So some resources are California's Mental Health Services Innovation Project. We have the link here. They're currently working with Contra Costa, Fresno, Mariposa, Monterey, Orange, and Shasta counties to develop different services for PADS and really innovate how PADS are streamlined and accessible when someone is in a crisis. The Mental Health America brief overview of the steps to creating a psychiatric advance directive is also a great resource. The National Resource Center on Psychiatric Advance Directives, they have a great FAQ that is really helpful in really understanding the PAD process and what happens during the PAD process, as well as when someone is in a crisis, what can happen and what that might look like. And SAMHSA has a really great resource, the Practical Guide for Creating a Psychiatric Advance Directive as well. There are actually sample pads in this resource, so it's great to see what they could potentially look like. So even for you as a mobile crisis team member, to just kind of get your eyes on what one might actually look like. So when you see one, you might be able to recognize it. And then the SMI Advisor application. This is an actual app for an SMI. We know is severe mental illness, and it's a My Mental Health Plan. It's a mobile app. So if they don't necessarily have it written down, they may have some sort of directive in this app. They may have had it uploaded some sort of way into the app, and they have it easily accessible whenever they need it. So these are also all great resources for mobile crisis teams to have and to also share with community members.
And so, in summary, what we went over today was what a PAD, a Psychiatric Advance Directive, is. It's a legal binding document, or it's a legal document allowing individuals to outline their preferences for mental health treatment, especially during crises, ensuring their wishes are honored and guiding their care. Although California lacks a specific PAD law, recent amendments to state advance directive law recognize mental health care decisions and allow PADs to be embedded within an advanced healthcare directive that can be registered with the state of California. Creating a PAD empowers individuals to control their behavioral health treatment. As Danielle has indicated earlier, it's really about empowering the individual to express their voice and choice when they're in a better state, or they're able to make those decisions. Who can best help them when they may enter that crisis. And PADs promote autonomy, informed decision making involving social networks, potentially reducing crisis duration, hospitalization, and coercion during mental health crises.
Thank you, David. We do have a slide here on references if you want to take some time to review that, and also just they're great resources as well. And we thank you for joining us today, and we hope you have a great rest of your day. If you have any questions or want some more additional information on PADS, psychiatric advance directives, please feel free to email us at mobilecrisisinfo@cars-rp.org, and we will be happy to address your questions as best as possible. Thank you for joining us, and have a great day.